Healthcare costs in retirement. All right, so I've done this. It's been a while since I've done this video, but it's important to understand because I think a lot of people really overestimate the costs they're going to have, and it's all because of A, it's unknown, but B, because we have this thing from Fidelity. You have to need $1,000,000,000,000 for healthcare. So this is from Vanguard Research from June 2018. Vanguard engaged Mercer Health and Benefits to develop a new model to forecast healthcare costs for retirees. All right, planning for an annual healthcare insurance premiums and out-of-pocket expenses at retirement should be distinct from long-term care expenses, 100%. Some research on healthcare costs in retirement estimates these expenses as a lifetime lump sum. Fidelity, which is freaking stupid, man. I hate that crap. We believe a better planning framework considers these costs as an annual expenses personalized to an individual's health status. Yep. And basically, Vanguard comes up with pretty much what I come up with. For a typical 65-year-old lady, Vanguard predicts an annual healthcare expense of about $5,200, and that was in 2018, which is basically spot on to where I predict in 2022. I usually say about $500 to $550 a month, all right, per beneficiary on Medicare. So we're talking about $6,000 to $6,500 a year per beneficiary on Medicare. That's what we use in my planning numbers, and I'm inflating that at 5.5% per year, according to the CMS, the Centers for Medicare and Medicaid Services. So that's what I use. I'm spot on with Vanguard. It's stupid to say we need $1 billion or $500,000 as a lump sum. No one ever does that for anything else. For some reason, people, Fidelity, want to do it for Medicare or healthcare, and that does not include long-term care. All right. So how do we come up with this number? It's quite simple. Part A is free. All right, that's a hospital insurance. That's Medicare hospital insurance. You paid for that with your taxes when you're working. Part B is your physician services. That's to see the doctor, see the nurse practitioner, see the registered nurse, to see the nursing assistant, the physician assistant, all that. That's about $200 a month. All right, that's right from the CMS, Centers for Medicare and Medicaid Services. Part D is prescription drugs. All right, that's about $50 a month. And again, this is 2022. So between those two right there, you're looking at about $250 a month. Notice I went from Part A, Part B to Part D. We skipped over Part C because Part C is Medicare Advantage, whereas not a biggest fan of that. I'd rather you go to Medicare Supplement as opposed to Part C, a Medicare supplemental policy, otherwise known as a Medigap policy. And I usually say that's about $200 a month there as well. So add all this stuff up. Remember, Medicare doesn't cover eyes, teeth, and the ears. All right, it doesn't cover all that. So you have some other expenses there too. So again, roughly $550 a month. All right, now you're going to have some out of pocket if you have an emergency and all that. I don't know how you plan for that actually. How do you plan for an out of pocket, the budget? Because an out of pocket probably not going to happen every year. It might never happen, and I don't know how you plan for that in your monthly budgeting for healthcare. I just don't know how you do that. So anyway, what we're going to do is we're going to use a worst case scenario from Denise, and you might remember Denise from the channel. She's on here, one of the mainstays, and basically she literally flatlined. She died. She had to get medevaced via helicopter to a hospital in North Carolina, and she's obviously survived. But the cost wasn't cheap. I said, "Would you mind, telling me the cost if I could share that?" She goes, "No." But because she was mostly in network, the total cost for her was about $5,800, even though the entirety of everything she did was $300,000. It only cost her $5,800 because she was in network. If she was out of network, she thinks her worst case scenario would have been about $85,000. All right. So what does that do with Medicare Advantage versus Medicare Supplement? Well, Medicare Supplement, you're in network to any doc who accepts Medicare. Medicare Advantage is kind of like an HMO. I mean, they have pricing. That's why it's discounted, because as long as you're in their network, it's going to be cheap. But I would think it'd be easy to go out of network, especially if you're traveling. So if you have the extra, it's going to cost you more for Medicare supplements than it would Medicare Advantage, most likely. But I would defer to Medicare supplements. I mean, literally 100 times out of 100. But I'm not an expert on that, so you have to figure that yourself. Let's see. My portion included the deductible plus my insurance out of pocket max. Plus, and a surprise to us, was co-insurance, 20% co-insurance for procedures like endoscopy. I don't know what the endoscopy. endoscopy. But they only covered 2, and she needed 4, so she had to pay 20% for the extra procedures that they needed to have. But she ran up against her out-of-pocket max, so that was okay. I mean, her out-of-pocket max is gonna be about, like I said, what, $5,500, $6,000 basically. In the middle of life or death medical emergency, you have no idea what would be required medically. Never mind whether or not you're in network, out of network, or never mind if the insurer considers 100% covered procedures. When insurer says an XYZ is 100% covered, what you don't realize is that 100% coverage is actually limited by the amount of XYZ procedures they do. I was fortunate that most of my services were in network, 100% Denise, absolutely. My best advice is be sure one is adequately insured. Despite being in great shape, things happen beyond our control. If I had not been fit going into this crisis, I 100% would have died. Forever, not just die and come back to life. Now, she didn't have an out of body experience or anything like that. But lesson number 2 is to get in shape, appropriate to your age. Another thing I learned is that actually the docs want you to be a BMI of 23. So if you're at least 23, if your BMI is lower than 23, they'd like to see an extra 10 pounds or so on you, especially if you're over 55. The reason is that when something medical hits an older woman, that extra 10 pounds can be the difference between life and death. The older we get, the more we need a little extra cushion to help us through a medical issue. This was news to me, but I heard it from multiple doctors in 2 different hospitals. All right, so there you go, man. Out-of-pocket network would have been $85,000, and also since most was in network, she'll pay less than $10,000 on a $300,000 procedure that literally saved her life. I mean, how do you plan for that? You can't. How do you budget that $10,000? I mean, you can budget it, but I don't know why people would do that, man. I just say, look, if we have this, we're gonna have to deal with it somehow. And like I ran the numbers on this. I said, well, what if you had $85,000 out of pocket and you had to pay the hospital back, and they charge you 6% a year interest, and you're going to pay it back over 15 years? You're going to be about a $700 a month payment. And that sucks, man. Don't get me wrong. That's horrible, but you're still alive, and A, it's not likely to happen, but B, if that's the worst case scenario, to be retired and enjoy your life and still be alive, I'd take that for sure. I don't want to take that, but it's not likely to happen. In fact, even Vanguard talks about it here. They say long-term care represents a separate planning challenge given the wide distribution of potential outcomes. Half of individuals will incur no long-term care costs, but there's a small but meaningful risk that costly care will be required for multiple years. We've done other videos on how to prepare for that. But again, how do you budget a small but meaningful risk? It's called insurance, long-term care insurance, or most of you already have your long-term care insurance already locked down. It's called paying off your house. Wife takes care of husband. When the wife needs it, she sells the house and goes to a facility. That's why there's no men in facilities, because a woman survives a man typically. And how does a woman survive to get in there? She sells a house. Pretty simple. Anyway, all right. Love to hear your thoughts. Thanks now.